let's talk a little bit about Cori's disease. So first, answer this question. See how this von Garke disease is different from this Cori's disease. You can see here. You can see von Garke disease. Von Garke disease. What is there? HH hyperlul. Hypoglycemia, very severe hypoglycemia. You can see here. This is moderate type of hyperglycemia. So this patient cannot, with von Garke disease, cannot tolerate a very severe. So do well. You can see child seems to do well until the time between feeding was increased. So up to 3 hours, this child do well. Hepatomegaly present in both disorder, von Garke, but you can see the very big clue here. 10%, only 10% of the normal amount of glucose was released. So glucose is releasing from this your liver, you know. So this is glycogen, and this is glycogen. Okay, this glycogen will degrade to, which is phosphorylase, and then with glucose 1 phosphate, and then to glucose 6 phosphate. And then what will happen? This glucose 6 phosphate, if this enzyme is absent, will not come. So no glucose will come out of the cell. Okay, no glucose will come out of the cell. But if glucose 6 phosphate is absent, no glucose will not come out of the cell. Now what will happen is, if this debranching enzyme is absent. So what does debranching enzyme do? Debranching enzyme, this actually last enzyme it puts here. So the complete degradation, this will not be completely degraded. So there will be, this glycogen will be degraded into this limit dextrinosis. There will be this type of twig-like thing. So only part of glycogen will be degraded. So because of that, what will happen? So this part of glycogen will only come out of the cell. Because of that, what will happen? This will accumulate and it will cause hepatomegaly. But it will contribute well to the blood glucose. So that is why you can see glycogen phosphorylase is able to act, and this phosphatase will able to act. And that is why this glucose will come out of the cell, and this there will be contribution of glucose little bit, 10%. You can see about 10% of normal glucose amount of blood glucose was released into circulation. So this is the reason. This is Cori disease. So a 6-month infant was brought to pediatrician due to pulsination, tender abdomen. Child seemed to do well until the time between feeding between this was increased 3 hours. So after 3 hours, this child is doing. So not severe hypoglycemia is there. Baby always seem hungry, irritable, not feed. Seizure is not there. Extreme presentation is presentation are a little bit mild. So upon examination, you can see this, and kidney also. So kidney sometimes is involved here also. So don't focus. This is like a confusing type of thing. Blood work showed hypoglycemia, and then subsequent laboratory analysis demonstrated this. And you don't see anywhere this hyperlactic acidemia. You don't see here a high lactic acid. You don't see here high uric acid. You don't see lactic acid, uric acid, and what else? Lipid. So that is why this is Cori disease. Did you get the difference between Cori disease and this von Garke disease?